Let's talk about the anterior source of the circular sarcoidosis. The anterior part of the circulovillus provides the anterior circulation of the brain and basically supplies the most part of the cerebral hemispheres and its deep structures. We have already talked about the interior source. We know that the interior source is through the internal carotid arteries and its branches, and we have already talked about the course and the location of internal carotid arteries. And once it is inside the cranial cavity, it gives off many branches, and it will be inside the cranial cavity after passing through the carotid canal of the temporal bone. So, if we talk about its branches in sequence, it gives off ophthalmic artery, which further gives off a branch named as central retinal artery, the only source of blood to the eyes. Then it gives off middle cerebral arteries, which supplies the lateral parts of the brain, the interior cerebral arteries, and posterior communicating arteries. The posterior communicating arteries connect the internal carotid artery to the vertebro-basilar system to complete the circle of Willis. Now let's repeat the whole circular sarcoidosis, as we have discussed the sources individually. Starting from the posterior source once again, the vertebral arteries that arise from the subclavian arteries, and after getting enter into the brain, these two arteries join to form a single artery known as the basilar artery, and basilar and vertebral arteries both give numerous branches. The branches of vertebral arteries are posterior inferior cerebral, interior and posterior spinal arteries. If we talk about the branches of basilar, they give the short branches named as pontine, anterior inferior cerebral, and the most important branches are its terminal branches named as posterior cerebral arteries. These posterior cerebral arteries are basically connected through the posterior communicating arteries to the interior part of the circular sarcoidosis to complete the circus, and connecting the interior and posterior sources. If we talk about the interior source, we know that it is through the internal carotid arteries, and internal carotid arteries also gives off artery gives off various branches. The main branches are the ophthalmic branch, which I have already discussed, that gives off the single source of blood to the eye, named as the central retinal artery. Then the middle cerebral, highlighted in purple. This artery supplies the lateral side of the brain, and then comes the posterior communicating arteries, and these posterior communicating arteries are connecting the internal carotid artery to the vertebral basilar system. So this is the circular sarcoidosis, and I am summarizing it, and the circular sarcoidosis is mainly formed by the two interior cerebral arteries, the two internal carotid arteries, one anterior communicating artery, two posterior communicating arteries, two posterior cerebral arteries, and one basilar artery. I did not talk about the communicating arteries. The interior cerebral arteries are the branches of internal carotid arteries, and these two interior cerebral arteries are joined by a single interior communicating artery. So we have two interior cerebral arteries, which are the branches of internal carotid arteries, two internal carotid arteries, one interior communicating artery, which is joining the interior cerebral arteries, two posterior communicating arteries, which are also the branches of internal carotid arteries. two posterior cerebral arteries. Posterior cerebral arteries both are the branches of terminating branches of basilar artery and one basilar artery. Okay, so from the circle, the anterior cerebral arteries pass forward to supply the anterior part of the brain. So the anterior part of the brain is supplied by the anterior cerebral arteries, and the middle cerebral arteries pass laterally to supply the sides of the brain, and the posterior cerebral arteries supply the posterior part of the brain. Branches of the basilar artery supply parts of the brain stem. We have discussed about the levels and the course and the branches of various arteries taking part in the formation of circular arteriosus. You can look in this image the level of the pons where the basilar artery is formed, and at the upper border of the pons the basilar artery is giving off its terminal branches, which are the posterior cerebral arteries, and these posterior cerebral arteries are joined through the posterior communicating arteries to the internal carotid arteries. The internal carotid arteries, on the other hand, are giving off its branches, the middle cerebral arteries supplying the lateral sides of the brain, the interior cerebral arteries supplying the front portion of the brain, and these two interior cerebral arteries are joined by a single interior communicating artery. And also the optic nerve is shown in this image in yellow. Now, if we talk about the importance of circular arteriosus, its importance is that it equalizes the blood flow between the left and right cerebral hemispheres, and it can allow the anastomotic circulation if parts are occluded. So this is a very good example of anastomosis or anastomotic circulation. Uh, if we take an example of the obstruction of blood supply through the left internal carotid artery, and blood cannot reach the front of the left side, then blood will be routed to this area through the interior communicating artery from right internal carotid artery. So if the left internal carotid artery is occluded, the blood can make its supply or its route to this area through the interior communicating artery from the right internal carotid artery. Uh, Another important thing is its clinical significance. Many pathologies can be formed in the circular arteriosus. Thrombosis, occlusion, aneurysm, rupture, infarction, ischemic attack, and cerebral hemorrhage. These all are the pathologies that can be formed in the circular arteriosus. If you have any question regarding this topic, you can ask me. Thank you so much.